It is December 14, 2023. I'm Dr. Deuk Majan. Our patient is from South Carolina, and she is here with lower back pain. When we did our MRI review with her, we determined that her back pain was coming from 3 discs, L4-S1, L4-S5, L5-S1. And she chose to do 2 of the 3, which is L4-S5 and L5-S1. So we will be doing the L4-S5 and L5-S1 discs today.
Good.
Shot? Yeah, it should be good. All right, good. I think this is probably a good entry point. Let's put some num-num. Uh-huh. She's had a prior laminectomy. She's had back pain for how long?
5 years.
5 years, at least. Shot? And when I examined her, I felt, Shot, that her pain was definitely coming from her discs. So we recommended the Deuk laser disc repair to eliminate the pain from these discs, and she agreed, and here she is. She's from South Carolina. Is that correct? Yeah? All right. So, step 1, let's get into the discs that we're going to fix. That would be number 4, 5, and 5, 1. Shot? The way we do that is we use a transforaminal approach. And her spine is pretty anterior, Shot. So I'm going to have to see if I can gain access. Shot, which I expect to. That looks good. That looks better. How is she, doctor? Shot?
How are you doing? You okay? She said yes, she's okay.
Wonderful. How many of these surgeries have you watched before you came here? 2? 3. Okay. All right, let's get an AP. I will use the front back sort of x-ray and the side-to-side x-ray to navigate. That looks pretty good. I think I can be a little bit more medial. I'm going to reposition just a little bit. You're doing great, by the way. You're supposed to be awake in case you were wondering. Shot? You're not imagining things. We're going to put you to sleep soon, but just not yet. We need your help, okay? Are you having any pain? Mm-hmm. Shot? All right, I can feel the herniation. That's 1 down. You're doing great, by the way. Let's go guide wire. So, because the spine is so far down, you can see, yeah, we're going to do a discogram, right? Yeah. You can see that right here, Henry. You see how the top of this needle is actually touching the body?
Yes.
So to get it out of the way so I can do the second one, I have to place a guide wire. Shot. And then we're going to remove the needle itself. Shot. Shot. Mm-hmm. Shot. All right, good. So now we're going to leave this guide wire while I remove the needle. Shot. Perfect. Num num. Give her a little bit more numbing medicine. You're doing great, by the way. Everything's going well. We're going to make our 1/4-inch incision. Patient is awake. We're going to get into the L4-5 next. Shot. Need to be a little bit lower. Shot. Can you give me a better shot than that shot? I don't think you're not parallel to that disc space. We need a wag. That's better, but you're too low. Well, you can see a screw in there. You guys see that at the bottom of the screen, Henry?
Yes, we do.
That's her hip. Uh-huh. That looks better. Shot. By the way, we have a new procedure now where you can avoid hip replacement and have a Deuk plasma rhizotomy instead. Shot. Are you having any pain? No. Okay, you're doing great, by the way. Shot. I'm right at your facet. Move your finger. Shot. So close. There we go. Shot. Any discomfort?
Are you comfortable? Yes.
Shot. Interesting angle. Huh? It's the lordosis. I think the scoliosis is not that bad. It's just the lordosis. So I'm trying to get into 4-5, and the angle of approach is preventing it. This is what is the famous dance? Huh?
The rumba?
The dance? No, what is it? Not the dance of the wooden soldiers. Swan Lake? Anybody?
Isn't that like the ballet?
Mm-hmm. Henry?
Currently looking it up.
I'm doing the spinal needle dance. Just type in famous dance of the, and then it should populate. Huh? I'm pretty sure it's Swan Lake. Ah, so close. We're like right there at the back of that vertebrae. I could try to come back a little bit and redirect. Where?
In your back?
Where? Huh, Henry?
That was famous dance of Sikkim?
No.
All right. Maybe I'm looking it up wrong. Hold on.
Just type in Swan Lake dance of the, and then see what it says. Shot? See if it prompts you. All right, well, worst case scenario, I'm going to have to just sit right outside the disc here until she's asleep, and then we'll be able to get in. Yeah.
Dance of the Little Swans?
No.
Dance of the Cygnets?
No.
Not
Is
much.
there another needle?
Yes, we have
All right. Shot. All right, that looks good. Shot. Are you comfy? All right. Take that. No pain right now? How bad is that on a scale of 1 to 10? What's the highest it goes? What's the highest?
8.
No higher than 8? Eight's the highest it went?
Yeah,
All right. Is that where you get your back pain?
yeah.
You get to go to sleep. When you wake up, we'll be done. That pain will be gone. There is another one we couldn't test, the L4-S1, but that's going to be painful as well, I'm sure of it. So, folks, she's had back pain for how many years? I think it's been longer, but it's probably been really bad for 5 years. And we've just tested the L5-S1 disc, which we thought was causing pain because it's herniated. It's right where her pain is. And it was an 8 out of 10 concordant. We're unable to test the 4-5 because basically I can't get in. You can see the needle is sitting right at the back of the disc. So we're going to get in later. All right, shot. We're going to start by doing her Deuk laser disc repair at L5-S1. Hold this here. Shot. Perfect. Huh? So I'm coming out with the needle. We're going to leave the guide wire. Next, we're going to go down the guide wire with the dilator. Num num. We'll put some more medicine to make her comfortable. By the way, our last patient, the one we just we did, was she first? No, she was, yeah, she was the first one.
Cervical.
She was the cervical. We also did her toe, a Deuk plasma rhizotomy, the first toe we've ever done. And her toe pain is gone completely. She's had arthritis in her right toe. She's a downhill skier from California. She's a mogul skier, very active person. And I just checked on her toe. She has zero pain in her toe. She's had pain in there for years from arthritis. So she asked if I could try the Deuk plasma rhizotomy on her toe. I said, sure, for you, I'll do it. And we did it, and now the pain is gone. So she's very happy. She's up walking around without toe pain. First in history. Take it. Take the guide wire, yeah. We're now inside the L5-S1 disc. Huge tear. The dilator went in so easily. That means the tear is quite big. The annular tear. Shot. All right, so the dilator is going forward. We need to probably, let's see if I can move just the sheath and not the dilator. There we go. So that's better. She doing all right? Let's bring the dilator back a little bit.
Structor, please. Structor.
Use your brain, Nikki. You know what's going to be next, right? You've seen it happen. So don't act like you don't know. Nice, that's good. Let's see where we are. Very good. So, shot. That should be good. Let's get that dilator out of there. And we're ready to do our first disc repair, number 5-1. So the needle is still right at the back of the L4-5.
It's pretty relaxed right now.
Yeah, I'll see if I can get it in. Okay. Henry, why don't you run our video showing how disc herniations cause so much pain? Can you do that?
Of course.
All right, welcome back. You now see how we fix these disc injuries. Thank you. By using a laser. The laser fiber there is 1 millimeter wide, and it's delivering energy from the laser machine to the tip, which is sitting inside the herniation and the annular tear. We looked at our success rates for this procedure at getting rid of back pain that comes from the disc, from a disc injury. And the success rate is 99.5% elimination of the back pain that comes from the disc. Most back pain comes from disc injuries. 85% of chronic back pain comes from disc injuries, and this treatment gets rid of 99.5% of that pain on average. I think our range was 90% up to 100 pain elimination. There was like 190% out of 100 patients, and there were a couple of 95s. The rest were all hundreds. So I feel good. This disc was painful for her. Look at the inflammatory tissue right there. You guys see it? I just zapped it away with the laser. Any questions?
No current questions, but we do have a comment from Premier Media Group on YouTube.
Of course.
And
Yes.
they said, "Hey team, happy to celebrate my 6-week graduation from 20 to 45 pounds."
Wonderful. Hopefully you're doing well, enjoying life, living the dream in the RV life that you are.
Got a prior patient?
Yeah.
Oh, that's cool. 6 weeks ago.
That's awesome.
Are you still in Phoenix, or where are you guys? Pray tell. Ah, I could swear it's got to be Waltz, either Dance of the Bumblebees or Waltz of the Bumblebees. That's what it is. It's bumblebees.
Not the swan.
No, it's part of Swan Lake.
Oh.
I think it's part of Swan Lake, if I'm not mistaken. There's March of the Wooden Soldiers, and there's something like Waltz of the Bumblebees or Dance of the Bumblebees.
The Flight of the Bumblebee.
Flight of the Bumblebees.
And
that's what it
it was used as the theme music for the radio movie and TV version of the Green Hornet.
But before the Green Hornet, it was popularized. Is it in Swan Lake?
No. It was in the Tale of Tsar Sultan.
Oh. I wish we could play it right now, but I don't want YouTube to give us a strike against
No.
playing content that's Premier Media Group. Maybe you can give us some advice on how we should label our video live streams to get more viewership from people that want to watch this stuff.
Actually, you know what? Yeah, Premier Media Group. If you're able to contact me or be able to you just reach me by email or phone number to talk more, just how we can, for one thing, work on the animation videos and just have to mute them or lower the music, raise up the audio, and also to help us out with try to see if we can gain viewership.
That'd be wonderful.
And they said Arizona still, but spending a month in Baltimore with family before we head to Orlando area to do some work during 2024.
Wonderful. Baltimore, Maryland. I like that place. The crabs. Don't catch any crabs while you're there. I'm sure he can appreciate that. By the way, that was Henry that was asking you to reach out to him.
You know what? I think I'm going to I'll just put my phone number in the live chat, and and see if he can we can stay in contact.
Yeah. Well, there's the end of the tear and the herniation. We're now in the outside of the disc, just in the outer part. And we've got to clean this up. Once I've cleaned this up, there's a piece of herniation right there. You guys see that? Just popped out of the tear. So it was stuck inside the tear. That's why annular tears don't heal. Maybe you get a picture of that, Henry.
Copy that.
So she's moving a little bit. That piece of herniation stuck in the tear right there is exactly why tears don't heal. Can you send that one to me? And just call it interposed herniation. Interposed spelled I-N-T-E-R-P-O-S-E-D. Send it to Sanjay as well.
Copy that.
And basically what it is when a herniation happens, it pushes through the annular tear, but sometimes it doesn't make it all the way out. Sometimes it actually gets stuck halfway. And that is what you just saw, a herniation stuck halfway. Well, it's stuck in the tear, it creates inflammation because the inflammatory system sees it there and says, hey, you're not supposed to be here, let's get rid of you. So it starts to attack it, the herniation, called interposed herniation, and that creates inflammation. That's where all the pain comes from. All right. Any questions from our audience?
No current questions. We do have a comment from Canes25 on YouTube. They said, good afternoon. Looks like you guys have a long schedule today. Best of luck.
Yeah, thank you. We do. And we actually had some interesting cases on, but they didn't get cleared by cardiology yet. So we have to postpone a couple of them till the cardiologist gives us the thumbs up. One of them is a cervical laminectomy. C4, yeah. We're going to go in and he's got spinal cord compression. Now, unfortunately, I cannot treat his spinal cord compression with the Deuk laser disc repair because he has a very, very calcified disc behind the disc, in front of the disc, making it impossible to fix with the laser. It's too much calcification. We call it OPLL, ossification of the posterior longitudinal ligament, and that's what he has. So when we first saw him and talked to him, we thought we could do the laser surgery, but after further evaluation, it turns out that a laminectomy is going to be his best option, cervical laminectomy, not lumbar. And I can do it without fusion. Yeah. All right, just about done here. Another 30 seconds or so. So we're going to move that cervical laminectomy to next week. We also did a cervical Deuk plasma rhizotomy. And she's doing well. She may even be gone by now, right? Still here? All right, laser. All right. Wonderful. All right, well, that should be it. A lot of scar tissue from chronic inflammation at 5-1. This is the L4-S1. Let me have the grabber for one more grab down. Let's just make sure we got everything. No loose pieces down there. I almost think I see something, but hard to tell. We are done. Done with one. I guess we could look at the nerve. The nerve is going to be right there in that fat, just outside the disc. That is the nerve root, is what I'm talking about. Nerve root, which sits just behind the disc within the neuroforamen. And the part of the nerve root there is called the dorsal root ganglion. Dorsal root ganglion is all the, careful grabbing, is all the cell bodies of the sensory nerves, the nerves that relay pain information up to the brain. So you can see the relationship between the sensory nerves being so close to the herniation, right? It's no wonder why there's so much leg symptoms when you have a herniated disc, because the entire nerve to the leg is right there behind the disc. I think we're okay. I mean, I expect to be able to get this. You just keep her safe. I don't need you to go deeper, unless you want to for some reason. Go ahead, Jordan. Yes. Are you talking to me?
Yeah, they're just giving me a number.
I'm sorry?
They're just giving me a number.
Are they talking to me or you? Oh, okay. Okay. Next disc, L4-5. Shot. Perfect. Here we go. I'm going to place the guide wire and hold it in position while I bring back the needle. Shot. Now the guide wire is literally sitting right at the back of the disc. And I should be able to safely get in there and get this thing done. Just got to be real careful. Take that. Shot. Uh-huh. Don't move anything, Luis. Nice and easy. Shot. All right. Shot. All right, I could do a little bit of numbing. Any questions?
No current questions.
Go ahead, inject. Yep. Shot. All right, coming in for a landing. Uh-huh. Coming in for our landing. Shot. Huh? It is, but we're okay. Yeah. Shot. Uh-huh. Just a little bit more and I got this. Shot. Uh-huh. Well, I think at this point, Luis, you can take that guide wire out. Mm-hmm. I'm sitting right on the disc. Shot? Yeah. Now, before you do that, I'd like to try to do a discogram. If you can hook up the blue dye. I'm in for sure. I just want to see if I can do a discogram. It sure be nice. Huh? I might need it. Wait, am I in here? Can't tell if I'm in. No. Shot. A little more. Shot. A little more. Is that it? Okay.
What do you feel, like tension or like you're hitting something?
Wouldn't you like to know?
Yes.
Shot? Yeah, there we go. All right.
more?
No, we're good. We're good.
When you say you feel the disc, like
Mm.
you feel the herniation. Do you
It's
feel
spongy.
like spongy?
Structure. Thank you.
All right, that's good.
Can I have a razor, please?
Yes, sir.
We have a few questions.
Sure.
This first one comes from Roscoe on YouTube,
Hello, Roscoe on YouTube. Welcome.
asking, L5 to S1 annular tear, give me a ballpark cost to repair, please. I know you have to evaluate first, but some ballpark figure, please?
Usually around 20 grand US. Don't hold me to that, but you asked for a ballpark. But it's pretty close. I always warn people though, don't try to diagnose yourself. It's a really bad idea. Even doctors have a hard time making the right diagnosis. Now, that said, some of my patients are better than the doctors out there, that's for sure. A lot better. The ones that actually watch a lot of our videos, like Roscoe. But even so, you want to make sure you get my opinion on what your cause of your symptoms are before you get too carried away with your own treatment and diagnosis. Hold on, let me get a little bit more. We are in the L4-5. You guys didn't wipe the end of this? Come on. Supposed to be holding that, not taking your hand off. What's this hand doing? Nothing is right. And when you're in the operating room, your hands have to always be doing something. So what should this hand be doing? Holding this. What should this hand be doing? Ready to go. Okay? I shouldn't have to tell you the simple things. You got to know them. All right, that disc is pretty fragmented.
We have another question.
Sure.
This comes from Samir on YouTube.
I would say 8 minutes, doctor. Sure, Samir on YouTube.
Yes.
Happy to take your question.
They said, hi, Dr. Duke. Thank you for the MRI review yesterday. What is L5 to S1 left you mentioned? You mean you'll enter the discs from the left side?
If I say left L5-S1, that means I'm entering the disc from the left side. That's correct. That is correct. If it's a Deuk laser disc repair, which I can't discuss, obviously, what we discussed yesterday publicly, but you can. A lot of inflammation here. You guys see all the red on the end plate? Just to the left of this piece of herniation. Huh?
Is that why you're having more difficult time getting
I could, no. No, the reason I had a difficult time getting in was because the angle.
Okay.
So my angle of approach, remember, is really optimal
Right.
for L5-S1. And then the other discs are usually easier to get into, so I always start with L5-S1. So whatever my L5-S1 approach is going to determine my entry point and approach for the other discs, which are easier to get into. So in her case, you know, I got into 5-1 nicely, but then 4-5 became challenging because of the angle that I had to use to get into 5-1. You want to try to avoid those kind of things. So the question that I was asked is, why was it hard to get into L4-5? And the answer was because of the angle that we were approaching it at. We were coming in at a steep angle that was oblique to the entrance of the disc. Let me have the grabber. Because she has so much inflammation in the disc, you could see a little bit of bleeding, which makes it harder to see. The blood fills the water column or irrigation column, and it makes it somewhat red or obscured. Is the next patient here? Now, fortunately, I've done many of these surgeries, so I know my way around pretty well. So I don't have to see perfectly clear on every single disc because I have a very good mind's eye view based on past surgeries, past experience. It's kind of like when you drive to work every morning. You may not even be thinking about the streets you're turning on consciously. You do it subconsciously, right? You can actually be on the phone talking to your friend maybe while you're driving. Hopefully not texting, just talking. And then you find yourself at work because you've done that route so many times, you don't actually have to consciously think about it. I'm the same way when I operate here. I've done this 5,000 discs now in basically 2,000 patients. And I know my way around the disc pretty well. Even when the visibility is poor, you still know, for example, on your way to work every morning when to turn, right? You have a sense of distance, even though it may be foggy and you can't see the road clearly. You still know when you're coming up to a turn. Same thing with surgery. The more you do the surgery, the more familiar you are with the territory. Grabber. These are all like loose chunks of disc material, and I don't want to leave them because I'm afraid that they might pop out. Okay? So I'm trying to remove as much of them as I can. Any more questions?
No current questions.
Too much, too long, okay? It should be a quick pinch and release. Nikki. You understand? Like a minute. That's pretty much it. Let's see what we got there. Yeah. Let's get the laser one more time. Yeah, I see where we are. Just underneath the nerve root. The traversing root.
We do have a question.
Sure, I'll take it.
This comes from Roscoe, once more on YouTube,
Hi, Roscoe.
asking, do you track your patient's results long-term so that it could be submitted to the insurance world for future coverage?
Insurance companies don't care about long-term results, Roscoe. The better the results, the less they want to cover the procedure. You don't understand. Insurance companies are not your friend. They're not there trying to do what's best for the patient. They're trying to do what's best for them. And what's best for the insurance company is for you not to get any surgery, because surgery is expensive. So they just want you to smoke marijuana for your back pain, because they don't pay for marijuana. They pay for narcotic or opioids, which, you know, are now illegal basically for doctors to prescribe. So the insurance companies have basically fought this war against opioids, not for your benefit, but for their benefit, so that they don't have to pay for them anymore. That saves them about $3 billion a year. Okay? So they don't do anything for you. You have to do for you. They're not your friend. The insurance company is your enemy, not your friend. And especially when it comes to specialty care, like spine surgery. Okay? So giving them good data, which we've already done, does not increase the likelihood they're going to pay for your surgery. Taking the insurance companies to trial and suing them for not paying and winning, that's how you get them to start covering things. And that's what's happened already with artificial discs and other treatments. People pay cash, they sue them in court, they win, and then the insurance company is forced to cover procedures. That's how it works in America. And that's not going to change anytime soon. The scope use was a 6. Thanks. All right, I'll come answer questions if you have them. Feel free to write them up. We're here at the Deuk Spine Institute. I have a patient who traveled from Ohio to Deuk Spine Institute for his lower back. And he's been through a lot of treatments in the past that didn't really work. They may have given him some temporary results. I'll let him tell you more about that. But he's here today, a new man, just 24 hours after his outpatient surgery. He had the Deuk laser disc repair. You can see in the video we made some small cuts on his back, went in through a natural opening in the spine called the neuroforamen. We didn't do any damage under the skin, and we were able to repair the herniations that have been plaguing him now for years. How long have you had problems with your back?
Since approximately 2009, quite a while.
All right, so about, what, 14 years now?
Yeah.
And you've had surgery before. How were those other surgeries?
I had 2 minor surgeries. One lasted for about, relieved my pains for 3 years. Second one, maybe 6 or 7, somewhat of the pain, enough to get me through. Over the last couple of years, the loss of balance, which really affected my job, was just getting worse and worse and worse. I really didn't know what to do. And I went through 3 local surgeons, and everybody, the only answer was fusion, fusion, fusion. That was pretty much going to end my career. So,
yeah,
I found this guy.
And you had surgery yesterday. How are you feeling today?
Just a little bit of soreness in my back. The balance is back. I know I'm on a way to recovery.
You look a little teared up there. Yeah? It's been a journey, hasn't it?
As soon as I did the video conference with you, sort of broke down like this too. So hoping
I understand.
they'd be back.
So can you tell the difference at this point, now that you've had the surgery?
Oh yeah.
Yeah?
Yeah.
You said you got up and you walked straight this morning.
I haven't been able to do that for over a year without falling. I couldn't walk down a hallway without grabbing the walls.
And the reason for that, your nerves were getting pinched pretty bad. And we went in there and unpinched them during your surgery with the laser. And we did not have to do a fusion, and you're not going to need a fusion. That's the great news.
Yes, it is.
And is there anything else you want to tell your fans out there?
I just hope more people that these doctors are only giving them that option, fusion. Come see this guy and don't ruin your life.
When do you head back?
Sunday.
Sunday. You're going to enjoy Orlando for a little
I'm
longer?
gonna try, yep.
Yeah, all right. We'll try to make it out to the Space Coast and go see the rockets over at the Kennedy Space Center. It's pretty cool over there.
Okay.
All right, sir.
Thank you, sir.
You're welcome. My pleasure. Let's get you guys out of here. Come on. Hey, good morning. I'm Dr. R. Deuk, CEO and founder of the Deuk Spine and Deuk Joint Institute. I'm here with a patient who's traveled from Pittsburgh to Florida. And what brought you here to the Deuk Spine Institute?
Well, I have had back pain for so long, and anything and everything we did didn't help. My wife did significant research. We found you online, actually, is how it started.
Excellent. And what kind of procedures did you have done before you came to Deuk Spine?
I've had 5 lower back surgeries, 1 fuse, and the others laminectomies and so on, all within the last 3 years.
And they were recommending another fusion for you, weren't they?
They were. That's when I really began to research other options. When they mentioned another fusing, I absolutely was not going to do that. So that began our research that ended up finding you.
The Deuk Spine Institute. And what we do differently, folks, is we cure pain with one procedure. Patients don't have to keep coming back having multiple procedures and pain management. And that's kind of where you were. You were in that surgery, pain management, surgery, pain management, surgery, pain management, back and forth. And that goes on if you keep doing it for the rest of your life. But you found a way to get out of pain and you came to Deuk Spine. How do you feel today?
Unbelievable. I have not felt this good in years, several years.
And you feeling good because we put you on some new pain pill that nobody else has?
Absolutely not. I've lived on pain pills up to this point. I'm on nothing. I have a prescription for some muscle relaxers, no pain pills. I'm on nothing.
And how did Deuk Spine Institute fix your back?
Had the L4-S1 laser surgery, and then the rhizotomy that was done a few days later. A combination of those two, I'm pain-free. I'm really pain-free.
I'd just like to point out that you, like many people, had more than one source to your back pain. You had discs that were causing the back pain, facet joints that were causing the back pain, sacroiliac joints that were causing the back pain, I think a piriformis that was causing the back pain. And because you were walking so funny, you were getting bursitis and other pain in your leg from the iliotibial band. We had to identify every one of those sources and treat everyone properly. And once that was done, it eliminates the pain permanently.
I have dreamt of feeling this way for years. Teared up a little bit this morning when I woke up. I could get out of bed without holding on to the wall, or it was just an incredible feeling.
Well, I'm very happy for you, and you could see we did your surgery with the laser, cleaning out your discs. Where did you go for your spine care? Was it a good center?
Prior to coming here,
Yeah.
I was at 2 major medical facilities in Western Pennsylvania and Eastern Ohio. Went through a lot of pain with the different procedures and surgeries I had done, and had no relief.
And what were these other facilities, you can say?
UPMC and Cleveland Clinic.
Yeah, 2 of the top spine institutions in the world, right?
Yes.
Great reputation,
Yes.
and yet they couldn't get you out of pain.
No.
And they were just ping-ponging you between surgery and pain management, surgery and pain management.
That's exactly what happened. Yes.
And there's no hope for actually getting cured because they don't have the cure to back pain. We do. Unfortunately, we've been trying to share that cure with them, but they're not interested. They just want to keep doing fusions because, well, let's say it, fusions make a lot more money than laser surgery does. It's hundreds of thousands, if not millions of dollars over your lifetime. That said, I'm glad you're doing well. When are you guys heading home?
Getting on a plane in a couple hours.
All right, very good. Is there anything you want to tell people out there in final remark?
I would just say that Deuk Spine Institute has been a lifesaver for me, literally. I would highly recommend it. I was being ping-ponged around for 5 years. I have dreamt of feeling like I feel right now for a very long time. So I cannot thank you, Dr. Patel, your entire staff. Everybody's been just incredible.
That's what we're here for, my friend.
Thank you, Doctor.
Give people back their lives.
Yes, thank you, sir.
All right, now go enjoy your Top Golf.
I will now. I will now.
All right, let's get you out of here.